everybody to Happy Health Hour. With me today are Nurse Lynda, Dr. M, Maria, and Dr. P, Parixith. Guys, before we start, I just love your handles. We just need to make a brand of your handles, Dr. P, Dr. M, Nurse Lynda. I think we just need to make a big brand of them and just get you out onto posters, onto TV, onto radio as these brands. So let's think about how we do that. But this week, putting that branding thing aside, we're going to talk about something really important, as we do every week, but really important because healthcare alone isn't enough, is it? This week's topic is the social determinants of health, and healthcare alone is not enough. Or is it? And I'm expecting conflicting views from the three of you. Why don't we start with Nurse Lynda? Lynda, can you just sort of outline some of the social determinants, the main social determinants of health?
Sure. So what is a social determinant is something that's not a disease state. It's how the patient lives. Do they have the finances to purchase food? Do they have the finances to purchase medication? Do they live in a home? Do they live in an RV? Do they live in a tent or under a tree? Do they have access to utilities, clean water, a restroom? Can they get to the office when they need to? Do they have transportation? And we don't typically ask these questions. So a patient will come in and right away we put our clinical hats on and what is your problem? And okay, we're going to do this. Oh, you can't breathe. You can't breathe at night. La, la, la. Long story short, you've got sleep apnea. I will put you on a CPAP machine. They live in a tent. There's no electricity.
Okay.
That's a
Okay,
very
good.
simple explanation.
Yeah, very, very good. So we're talking about things like living conditions, education. Could that be a social
Yes,
determinant?
it's all part of it.
Yeah.
Absolutely. What's their education level? Do they have any, are they on the spectrum? Do they have any issues, with learning? Do they live alone? And then of course you look at all of their diagnoses. But if they're not able to follow through the things that you're trying to do for them, then everything that you've prescribed, everything you've tried to do is for naught.
Okay. All right. Linda, I'll come back to you on and sort of dig a little bit deeper on these. But Dr. P, I have an interesting question for you because, you always address things from a very philosophical, wide, um, centuries long view about these things. So, if I asked you, does society dictate health, or does healthcare dictate a strong society?
That question sounds very familiar, but let's talk about it. Depends on how you define health as, and you will see that a tendency in our minds is to define health only on an individual scale. But health transcends individuality. Health is a social phenomenon as much as it is a global phenomenon. And health is also not just an individual phenomenon. If you go further down, it's also a cellular phenomenon. More and more research is showing that our cells have consciousness. So now, if you look at health on a global level, I really don't have to tell you how healthy we are. All you have to look at the symptoms that are coming out and how we are addressing these problems. It doesn't matter what side of the debate you belong to, left, right, above, lower, it doesn't matter to me. I think most of us will reasonably agree that there is lack of ease in the world as we live in, which is called dis-ease. The ease of living is not there. That's what disease is. Health has to understand health fully. Health has to be taken on a global scale or a holistic scale. Otherwise, health does not exist. So obviously, we have created these problems across the globe. with our limited minds and limited understanding and ego and greed and avarice and jealousy and all those things, ambition, all that is there. But that itself is lack of health, which has created these problems. So these are intertwined. Health and society are intertwined because health is the state of the society. Now, as you divide it, the moment you start dividing it, you're looking at it in a dualistic way. Now, the question is, if I see one worse affecting the other, which is irreversibly affecting the first one, health is affecting the society, society is affecting the health, then where do we cut that Gordian's knot? And it has to happen with a breakthrough. Somewhere you have to be able to break through. That breakthrough happens within, somewhere within, either in the mind or the heart, where you are able to free yourself from this whole trap and are able to stand outside. You could do it as a thought experiment. You could do it actually. You could do it with that feeling which we abuse by calling love, that feeling that transcends individuality, and it's oft abused, so I will not use it too much, but a feeling of togetherness, of compassion, of realizing that one's health is an intimate part of the society's and the globe's health. I've said a lot of things, and we can go on, but let me stop here. If I've been able to kind of bring you to at least the way I see health as. Back
So
to
I
you.
think I think we'll come back to this, because I think very appropriately, not otherwise, very appropriately, you've confused the issue even more. But I think that just goes to say that the issue is complex,
my
as well
philosophy
as
is, if you
Yeah,
can't convince others,
Yogi
confuse them.
Berra's philosophy.
yeah, exactly. I was going to say it's a very complex issue, so it is a confusing issue. But part of your personality is to confuse the issue. So
Yeah, it's very complex and it's very simple. So I'll stop there and let's go back to you.
okay, we'll come back to you. But Dr. M, I want to pick up on something that Dr. P said, which is the breakthrough. Okay, and I think that resonated with me. I think it may have resonated with our viewers as well. That if you can have some sort of breakthrough in your really excellent functional medicine practice, can you talk us through how you do achieve these breakthroughs in the minds of others? How do you self-actualize on behalf of others so that they achieve a breakthrough?
I do. I do as the divine brings to me. I do as I am instructed, and when I'm inspired, I help others. At least I think I do. You know, they come back. If they come back, I know I've made some kind of an impression. So what I do is really educate through the wisdom that I've gleaned and I've experienced over my lifetime. I bring education to this whole scene, and I try to educate people on how to become better at anything that they would like to do or like to be. So it's all about educating here, and in my surroundings, in my setting, with the wellness center that we have. Um, it's like show and tell. Getting people to be aligned with themselves, to understand that self-love and self-care is really key, so that if you care for the self, you care for the entire universe, because you basically are a microcosm of the macrocosm. So self-care, very, very important, and teaching how to, because a lot of people don't know how. They don't know where to begin. They kind of fumble through their lives. I like to get younger folks in as soon as possible so that I could help them. But oftentimes I have more middle-aged and higher, but I do get young ones in. So education is really key, and then demonstrating, being a role model, showing people how to do things with themselves, how to better care, how to prevent a condition, all diseases. Being in the right mind. Not letting the entire world's madness, the madness that goes on every single day, every single moment, get to you. I've had to learn myself, and it's important that we know how to control that and prevent all of these interfering elements so that we don't deteriorate, we don't break down. I've also been able to learn so much in my studies on the power of nature, healing power of nature. And again, it's all about educating people on how to take better care at home, in their office, in their school, wherever they dwell, on the ocean, in the mountains. Pay attention, be conscious. That's how it has to be. And I have to be a role model, a teacher. I can't just say things and not do them myself. I need to be that role model, and have that, have that understood. And I take care of people as a whole. I talk about what Lynda and Dr. P are talking about with this whole thing of socialization and social health. Health is social. Health is the entire world. So I have to bring that in and show one that you are just part of a whole universe, and we have to treat you wholly, not just, okay, here's your diagnosis and just take this. You have to know all of that which the person's about, how they live, what their conditions are, and why they've put themselves in those conditions. Because some people, they could have made it better for themselves, and some perhaps not. But we've got to get to the bottom. Why are you in this position? And educate on how you can make it better overall.
I'm going to come back to this a little bit later. Just 1 second, Linda. I'm always fascinated how structurally organized you are in many ways, and how you sort of wrap a layer of creativity around that. I think it's always fascinating, really, how you work. You work in a very unique way. Linda, you had your hand up, but say what you want. But I'm going to ask the question at the same time. Talk through some examples. You said you had some examples you were going to talk through, but feel free to tell us what you were going to tell us, but then go through some examples for us.
I believe it's one and the same. While Dr. P and Dr. M are talking about nurture versus nature, so to speak, the whole macrocosm of everything. I am a certified case manager and have been for many, many, many years.
What does that mean before you carry on? What does that mean?
A case manager typically is an RN, first of all, because they have to have a certain amount of training in order to be able to ask the right questions and then use the resources that are out there in society. And basically what they are is they're advocates for these patients who don't know how to fix the situation they're in. They find themselves in a situation because medicine put them there, and trying to treat whatever it is they've got, and they don't know how to deal with it. Their equipment didn't come. Or I have a story about a woman who had both of her knees replaced, and the discharge planner at the hospital, she rehabbed, she did great. They sent her home, but I was the home health nurse who was supposed to receive this patient at the other end, and she lived in a stilt home at the beach. No elevator. She just had both her knees done. How is she supposed to get into her house?
Yeah.
Stop the discharge.
Yeah.
Another case, patient was discharged from the hospital. I was the admitting nurse, and I met the patient at his home. He had been discharged to a screen enclosure on the back of the house with no access to water, the bathroom, the inside of the house, and he had 104 fever. I called 911 and sent him right back to the hospital, and they came out and said to me, "Oh, this guy's a frequent flyer." I said, "Are you refusing to transport him? What is the story?" So The social determinants of health play a very large part when patients are being transferred from one level of care to another. That's one issue. Another issue is, and I'm going to tell the story of what happened in Dr. P's practice. There was a patient who had gone on a cruise, but sometime after she had left on this cruise, the information came into the office through a chest x-ray that she had pneumonia and it had to be treated. And she was on a cruise and they didn't know what cruise line, the whole 9 yards, but the case management department hunted her down, got in touch with the ship's physician, and the Dr. P's office spoke to the ship's physician, and the woman was taken care of. Her medication was prescribed. She was able to get it. Hurrah, hurrah. They were the heroes. There are so many. So I'm talking about where the rubber meets the road, where an individual patient has gotten into a situation. They don't know how to get out of it. They don't know what's available in the community. And it's these trained people, these nurses, this level of medicine that is like the safety net and the advocate to try to get the patient the things that they need to get better. They got into the situation. Yes, maybe it was, a socially programmed thing. I mean, people become homeless for many, many reasons, right? But that in itself is a tremendous social determinant of health. How are they going to get to the doctor's office if they need electricity, if they need sanitary conditions? So there's so many things. And it didn't just happen. They ended up that way because of the things that Dr. P and Dr. M were talking about. But now they're in the situation. Who helps them? Who finds, how do you help them go over and above the actual medical treatment plan? Now you have to have another treatment plan just to get the treatment to them. And that's what I'm talking about. That's the nitty gritty. That's where the rubber meets the road. And there's a whole level of healthcare that I don't believe we have paid enough attention to. And the time has come because there are so many who are in these situations, whether they lost their job, whether they've got psychological problems. And we've talked about mental health care in this country, or the lack thereof. There are so many reasons why a patient finds themselves in that kind of a situation. How do we help them? How do we get them what they need? That's the social determinants of health from where I sit.
This is a fascinating topic because we're moving from the philosophical to the practical, and now we're going to go back to the philosophical with Dr. P. Dr. P, did you have to go? Did you? I saw you motioning towards somewhere. Do you have to go?
Yeah, I may have to go. I'm sorry.
That's okay. Do you have to go now?
Yeah.
Okay, no worries. We'll
Can I
carry on.
come back? If it's resolved, I'll come back.
Just go. Yeah, come back. You're a healthcare professional. You're a doctor. If you have
Let
to
me
go,
take
you
care
have
of
to go.
Yeah.
Yeah,
Sorry.
and we'll
Okay.
pick it up. Just come back when you can. So to both of you, then I want to ask the question that I was going to ask Dr. P. And before I do, I will add this is yet another topic, Colin, our producer, that we're going to have to cover again because 30 minutes is 30 minutes is not enough for this topic. So, Lynda, both of you, the question I was going to ask Dr. P, I want to go back to self-actualizing in others. That's not really a good phrase because you can't really self-actualize in others. So people have to self-actualize themselves. But to use Dr. M's narrative about educating others, how do you get at scale? How do you get this education across to hundreds of thousands, millions of people that they've got to take this social determinant aspect of health more seriously that as the health? It seems like an impossible question. First Nurse Lynda, and then Dr. M. How do we do that? How do we scale that?
Well, it is. It is being scaled. It has been being scaled for many, many years. You have the CDC. You have your local health departments. You have various other groups that are out there trying. The American Heart Association, all of these different, the American Diabetic Association, all these different approaches to education. And they are out. I mean, they actually have these initiatives that follow certain types of people to try to get the information to them and to try to educate them as to what's out there that can help them. So you do have public health, which is what we're talking about here. The public health at that level, now you're at a much higher level, which a much broader spectrum of reach. And so the public health services are out there trying to educate. Problem is, if you're living in a tent, we have no electricity. How do you know? How do you know? So, it's a problem that doesn't have one answer. It really doesn't. In the office practice, where you're one-on-one with these people, if you ask the questions and you get the answers from the patient, if you can get the patient to tell you honestly what their situation is, then you can help them, because you can't fix what you don't know is broken. You just can't. So if you don't ask the questions and you just blithely go on and say, okay, you've got this, so we're going to do this, and you give them whatever and they leave, you don't know. Did they fill the medication? Were they able to? Did they have the money? Did they give up eating so that they could get their medication? You don't know if you don't ask the questions. And so the Social Determinants of Health is a questionnaire that every single patient should be filling out at least once a year. And if they run into any kind of issue, it should be updated. That's the only
Thank
way you're
you.
going to know on that level.
Thank you, Lynda. Dr. M, what can you add to that? I mean, how do you scale this? How does this become more scalable? Because I just bet that if a patient isn't seeing a caring physician or nurse, they're not getting this level of instruction and care. They're not. So how is it scaled?
Yeah, well, as Linda points out, there are people who are in that position, the so-called the indigent, those who have limited capacity and or their situations, their domicile is a tent perhaps, or a blanket. Those people have to be reached out to by local people who care. I mean, the politicians can talk big talks, but it has to be a grassroots local when it comes down to some of these folks who really don't have the means and so forth. And most of them don't because of some kind of major issue, emotional, psychological trauma. There perhaps a lot of people who are military, and they've suffered and they're homeless. People living out of cars or near dumpsters. We need local people to rise up, and I've said that a number of times here at our center. We have to reach out to each other and touch. We have to touch people, and to offer meetings, where people can gather, town hall meetings, free, discussions, lectures. I try to do things of that nature here, again, here in our little area. And we have to also call upon the local politicians, because you can only do what you can do in your community and or surrounding. You can only do so much. I mean, we're not going to, perhaps we can impact somebody far away, but we have to be role models. We have to be the ones to make these efforts. Nurses are wonderful people. They go out of their way usually to, to see who's in need, and they start programs. Hospice, I think, was probably started by nurses. If correct me if I'm wrong, Linda. But I mean, you have those who really care. So we have to foster that concern and care, and raise the issues wherever we are, whether it's myself, another doctor, a health center of any sort, the Department of Health. They really need to reach out and get messages out to people. Perhaps, putting some type of notifications, signage, this is happening. Come join us. We have to reach out to each other, because really we are social beings. We are here for each other. It's all about, me helping you, or you helping me. I mean, there's no, no, I don't do that. Those of us who have the means, or the intelligence, or the whatever you want to call it, the care, the compassion, which should all be there in all of us, we should be reaching out to each other. So it has to be that we make the notifications, send out the messages. Everybody's got a cell phone. Even these people who have no homes have cell phones. But if we have local people who will go around and check out these little spots and places where these people hide and dwell, some of them you may never change. Now, Ted, some of them you'll never change. This is the way they live. You could only change what you can, as the Serenity Prayer goes. So we have the courage and the knowledge and whatever, so we do the best we can to get that out there, and try to get it out to the powers that be, who are supposedly in charge and leading, and let them know. We need to be voices. We need to be, spreading the messages everywhere. We need help, and let's do it together.
Thank you, Dr. M. And Dr. P, welcome back. And healthcare in practice there, you had to go out and do some work. And so it's the final question to you. You're going to wrap this up for us. So give us one of your philosophical soliloquies, if you would, to finish. And it's the same question, really. And maybe I'll say it in a different way. It's just, how do we all reach this? I mean, I know you very well. You're somebody who has self-actualized over and over again during your life. You've decided that you had an aim. You've self-actualized that to that. How, in terms of the social determinants of health, these important things that go beyond simple healthcare, have nothing simple about healthcare, but you know what I mean. How do we scale that to hundreds of thousands, millions of people? I asked Dr. M and Lynda the same thing.
First step is to realize that you cannot scale anything. You have to first focus on yourself. There's nothing to scale. The moment you scale yourself, you scale the world. What will you spread around if you're totally confused and obfuscated? You'll only spread more confusion, which is what most of us do anyway. I mean, our healthcare whole system is a disease system. Patients come to me for a pill, I write the medication, they're gone. That is a disease. That is a problem. Why are we acting after the fact? Why can we not be smarter than that? We should be smarter. So, patient with a low oxygen, not using oxygen. I've reached a point where I don't get upset anymore with patients. I don't stop yelling. That's a big breakthrough for me. I said there's a very simple decision. I want to live longer, I use the oxygen. I don't want to live longer, don't use the oxygen. Whatever you like is fine. Finally, I leave the decision to them. But my own health, no, I'm not taking it in an egoistic manner. Realizing that there is a form and a name called Dr. P, Dr. Singh, whatever it is, that has to Dr. P. First, I have to bring myself to a state of health. And that doesn't have to be, even though we said holistic health, some realization that I have to be in a place that is healthy. If I'm diseased, I'm only going to spread disease everywhere. Physician, heal thyself. So if I'm reaching from a place of calm, compassion, tenderness, gentleness, sensitivity, I can bring in health. Health is not one shot cure all. That itself is a wrong concept. Health comes in very small doses. It's almost homeopathic, although all my Western practitioner friends will get upset. It comes in homeopathic doses, very small movements. But those are far more important than the heavy doses of drugs and interventions that we make. Starts with oneself becoming healthy. Understanding what health is. Swasthya in Sanskrit means being seated, settled within oneself. Am I settled within myself? I can assure you that most of my patients are not settled. They're not even settled in someone else. So how can they settle in themselves? Now, reaching a state of health is a dynamic process. So it's not like I've become healthy and everybody's unhealthy. That movement starts happening, and that movement, that dynamic movement with others, with nature, with the world. Am I impacting the world in a healthy way? Am I bringing to them what I would bring to myself? Again, that kind of an interaction comes. But the first step is to look at oneself and look at one's own diseases. And that is something we don't do as healers. Healers have to look at the disease that is within and without. And that is the other duality we have to let go of, the within and without. I know I've confused you again successfully, but let's appreciate that health is a far wider concept than
Yes.
we realize. In fact, the first hymn of the Rig Veda, which is the first poem of humanity, the first prayer to Agni, which is our inner fire, our all energy, is to bring this selfhood to the whole universe, this healing, this auspiciousness, this wellness to the whole universe. So it's an ancient human aspiration, and I think we should continue with that in deeper and deeper ways.
What a lovely, confusing but poetic way to end this week's episode, Dr. P. Thank you, Dr. P. Thank you, Dr. M and Nurse Lynda. We're going to have to carry this conversation on. Sorry, Dr. P, you want to say
And you know
something?
the height of it? Now I'm myself confused. I thought I was very clear before I started. What did I
Okay.
just say?
I think we have to promise our viewers that we are going to have a second episode in the near future about the addressing social determinants of health. But I think it was super important to have this level of philosophical discussion, because the reality is it is confusing, and we would not be being real if we tried to mimic or narrate a non-confused state to something in reality which is very complex and confusing. But anyway, for this week's show, it's goodbye from me, and it's goodbye from Dr. M, Dr. P, and Nurse Lynda. Nice to see you all again.
Ciao.